myself Professor Dr Srikant Kumar Dhar from Bhubaneswar, Odisha. Welcome you. I am here to present you about computer vision syndrome. What is this? The definition says that if you are using computer or substances like that with bright illumination for more duration, it has got some complex effect on eye and non-visual complaints also. This is what is computer vision syndrome. Why this is occurring? You know, in last 1 or 2 years we are suffering from COVID and its effects, and due to this there is almost use of computer has increased. In 2021 first quarter there is 72% import of in India, around 4 million desktop or computer appliances. That is why we are using much, and it is seen that the internet use has been doubled, or even it is 5 times since last 5 years. If you see the use of use in rural population has also increased 2 to 3 times, and in urban population around 43% are using internet and appliances. So that is why your use of these appliances are causing damage to your eyes, pressure to your eyes, and the near vision is affected, causing the computer vision syndrome. So what are the symptoms? The symptoms is due to this pressure on eye, and the symptoms are ophthalmic and non-ophthalmic. Eye features like blurring of vision, irritation and dryness, and non-visual complaints like headache, shoulder pain, neck pain. These are the features for which this forum is useful, not useful to this syndrome, the computer vision syndrome. Most of the patients go to the ophthalmologist, but the physician face this problem in post-COVID era, because patients are coming with headache, shoulder pain, neck pain, and non-specific complaints of fatigability. Why this is occurring? The pathogenesis is whenever you are having some ophthalmic problem or some visual problem earlier, because we are not regularly checking our eyes, if you have come some power problem in your eye, then you might not be focusing your eyes to the system, whether it may be a computer or it may be a mobile. In that case, you will have a pain in your ciliary muscle, there will be focus problem, and there will be strain in your eyes causing headache, and there will be postural problem whenever you are having a refractory issues. The postural problem which cause neck pain and shoulder pain. That is why the cause of this type of symptoms and visual problems like dry eye is the cause, main cause of all these ophthalmic symptoms. What is dry eye? You know, we have to blink for around 15 times in a minute, but whenever you are using this bright light or to any system, or you may say to mobile, you are not blinking much, so the tear film is not been made easily. So you got a dry eye, for which you have a irritable symptoms to your eye as well as headache. So for this we have to know what are the problem, the pathophysiology, and that we have to correct. In the management part, we have to correct all these things. First is your posture, your chair design should be adjustable to your light source. There should be proper illumination, and the light source, you should have a lesser blue light from your system. As far as practicable, avoid the use. It is said that if you use more than 4 hours of this bright light or this computer or this laptop or a mobile for more than 4 hours, probably you are going to get in near future computer vision syndrome, which is the main symptoms nowadays in almost all ages, maybe children, maybe adult, or maybe old age person. How to correct this? Probably there are some modalities of treatment. There are 4 phases, phase 1, phase 2, phase 3, or phase 3, or stage 1, stage 2 we can say. The stage 1 modality is for the physician. First and foremost, you have to reduce your use, or if you are using the computer or this type of instrument, probably you have to use 20-20-20 rule. What is that? In every 20 minutes you have to look for a 20-foot distance for 20 seconds, and you have to have some postural changes in between. You have to have a good chair design for proper posture, proper neck posture, and proper illumination source also. The light should be appropriate at an appropriate head distance of around 50 inch, and the side light should be around 20 inch, and it should be 3500 to 3500K illumination. That is what is important, and your posture and the system should have this switched on of the illumination system. So you should have a lesser stress on your eye, so that you will not be getting this type of problem. And the second thing is when to refer to a ophthalmologist. Whenever there is severe dry eyes, a patient has to be taken the stage 2 or stage 3, where they use tetracycline, cyclosporin like immunomodulators, or sometimes anti-inflammatory drug, and sometimes surgical intervention in stage 3 or stage 4. They punctal plug and punctal cautery have been done by the ophthalmologist. So, whenever the symptoms is persisting or not been corrected with phase 1 of treatment, probably you have to send to the ophthalmologist. The first and foremost thing is you have to check with the ophthalmologist whether you are having a visual problem. So, annually or in this post-COVID era, I will say every 6 months you have to visit a ophthalmologist for your general eye checkup, for refractory problems and any other rather than refractory problem, so that you will have less computer vision syndrome. So, if you are using a computer, probably we are going to get these symptoms more often in near future because of the more use of this computer and this bright illuminated sources. So, be cautious and train the patient so that they will be checking annually or every 6 months to the ophthalmologist, and don't hesitate to be healthy and have a hydrated life. You have to take much more water if you are using computer in between. Thank you everybody for patient hearing. Namaskar.